really our key findings in this were just like the importance of those historical experiences within those social milieux. So really pulling out the influence of context and how this is unique for this particular age group, because these were unique circumstances and unique challenges, some really, I would say, just unbelievable hardships that were present for these folks as they were just existing in their worlds, the things that they had to navigate, the stuff that they just had to figure out how to deal with to simply manage their health. Because this, and I come to call it adversity, living through HIV, historical and ongoing discrimination, problematic engagement with health services, and complex chronic and acute health issues, like that, all of those things together comprise adversity, and that just basically subsumed the lives of participants. Like that was their reality. That's basically what they're living with day to day. And in order to manage their health, they had to overcome all of those things. Like I think about, like, I don't have to deal with any of that to manage my health. Like that's not even, I don't even have to think about any of those things. So just a very different experience, and understanding and appreciating what it takes to overcome those things, to simply, promote your health and navigate health challenges, was tremendous. And of course, time again, recognizing how time plays it's such an important role in recognizing that, time is the function by which so many of these pieces have occurred, and over such a long period of time. Like a number of the participants have HIV, and so looking at what it is like to deal with a chronic health issue, like that's very different from dealing with an acute health issue. So for this particular paper from the dissertation, overcoming adversity is through grounded theory. It's recognized as the core process. So in everything that they're doing, overcoming adversity underpins all of the strategies that they use to manage their health. We're engaging in health promoting practices, advocating for health needs, and being knowledgeable about health issues and treatments. So those were the three key thematic processes that we found, that I found as I was working through the analysis. And I was going through the steps of going through the data and analyzing and finding, all right, so what's consistent here? And those were overwhelmingly evident in how men thought about their health and what they were doing to maintain and promote their health. And that, I have a little piece of this in this sociological publication that speaks to this, sense of kind of neoliberalism, neoliberal ideology kind of permeating our existence in society and emphasizing the individual's responsibility to look after their health. And I kind of layered that in with, discrimination and experiencing that discrimination as a gay man, because you don't always feel comfortable. A lot of the participants had unpleasant experiences with health services and health professionals. And so feeling like, if I want to be well, it is up to me. And so recognizing the intention and the dedication and the energy that was put into, all right, I'm going to look after myself, and I need to do that by getting educated on health issues and the treatments that are available for these particular health concerns. And what can I do to better my health so I can engage in all these practices. And I really need to advocate for myself. No, I really feel like I would like to have this further investigated. I really like to have some blood work done. And having that confidence by educating themselves about, this is complex stuff. Wow, I'm really impressed with your level of understanding about all of these health conditions and the diagnostics that are used, and being able to speak confidently and say, hey, I think I need this. It was unreal. So those were some of the other aspects of this that we discuss a little bit in the discussion portion of the paper. But really, that's those were our key thematic processes that came out for health management.